medical colleges. And with us today, we have Keith Hassell, who is, Keith joined the career development at the University of Bridgeport as a director in 2014. Prior to going to UB, he spent the previous 7 years working with career development in higher ed. His primary focus has been increasing student utilization, developing professional opportunities, as well as promoting individual professional development for his students. He's well versed in career coaching and counseling, covering topics such as major exploration, resume cover letter construction, mock interviews, LinkedIn, social media, etc. Keith is really involved with the City of Bridgeport. He holds positions as founding chair of Thrive, leadership of Bridgeport Board of Directors, and is a regional business council executive member. He's got a bachelor's degree from East Stroudsburg University and a master's from Long Island University. Our first speaker today is Joanna Hagan. Joanna has been the current, she is the current Director of Career Services for the Southwest College of Naturopathic Medicine since 2001. And she offers individualized coaching for success to any and all SCNM students and alumni. In 2001, she established the very first career center in the profession, and in 2005, she was voted Teacher of the Year by the graduating class of SCNM. In 2010, she created ndjoblink.com, which is a centralized website for naturopathic employment opportunities in North America. Currently, she's spearheading research measuring the social emotional intelligence success traits of naturopathic physicians. She's an honors graduate in healthcare MBA program at the University of Phoenix and a graduate of the University of Connecticut in biology and education. And so with that, I am going to turn this over to Joanna, who is going to start on our presentation this morning, or afternoon, or evening, depending on what time zone you're in. Thank you so much, and Joanna, please go ahead.
Thank you. Well, welcome to the naturopathic profession. The first slide is the ND title. The ND title is the only, the only physician-level practitioner that's licensed, that's important, trained, and recognized as able to practice natural medicine. One of the things I want you to note is that naturopathic physicians are experts in natural medicine, highly, highly in demand. So why should you consider naturopathic medicine? Well, I'm passionate about it because I'm a walking billboard for it because of my personal health. But let me tell you, you're in the process of changing healthcare in the United States as well as the health of the people around the world. This is a worldwide movement, and it's slowly but surely growing. It's flexible, it's wide open, you can do a lot of things once you get that doctor degree in front of your name. And then lastly, you can make a lot of money. It depends on how hard you want to work. It's incredibly flexible. This is a family-friendly profession. If you want to raise a family and work part-time, you can still make good money. Next slide. Naturopathic doctors are qualified to use nutrition, botanicals, lifestyle coaching, acupuncture only in the state of Arizona, and you'll notice there's a little asterisk. Everything is dependent upon the state in which you practice. Naturopathic manipulation, which is similar to chiropractic, homeopathy, hydrotherapy, and even more. And they're also qualified to, yes, prescribe drugs, we'll go into that in a minute, order lab tests, perform minor surgery, deliver babies with midwifery certificates, sign birth and death certificates, perform IV therapy, injection therapy, perform stem cell replacement. Now, from a demand point of view and success, the last three, performing IV therapy, injection therapy, and stem cell replacement, is high in demand and very, very much many NDs, at least in our area, are doing this and are being very successful in relieving and stopping pain. Because remember, we get to the root cause. Prescribing drugs is limited by the state, but it's not to put people on drugs, it's to take them off. Concentrated areas of focus. So if you just want to see elderly people or men or women or kids, or you have a particular passion for a disease, you can concentrate your practice in that. Women's health, very popular. Men's health is increasing. Pain management, as I mentioned earlier, is increasing in demand. Never advertised. It's all through networking. It's who you know and what they know about you that counts. So, do you sit down and talk to NDs outside of school? If you're just doing the minimum, then you will get the minimum. But naturopathic doctors are looking for people that will go above and beyond what's considered minimum. So, how proactive are you? Are you visiting other doctors? Are you taking rotations with doctors in the geographic area that you want to practice in? Do you attend workshops and professional association meetings so you can meet them? Do you perform outside rotations at your own expense and not for credit? You getting the drift? You have to go above and beyond. If you're planning on opening up your own practice, have your business plan and have it at least start working on it 2 years, if not sooner, 2 years before you graduate. So by the time you pass your boards and you get your board scores, you're ready to rock and roll. The day you get licensed is the day you open up. And here are some examples of naturopathic doctors changing the world. We have Dr. Holly Lucille, and Dr. Lucille has been voted one of the top influential 100 people in the United States. She also has her own TV show in the LA area called The Myth-Defying Dr. Holly, and she also has her own radio talk show called Inherently You. So this is an example of how she's spreading the good news and her passion of naturopathic medicine, and she's doing it through the media. And here's another example. This is Dr. Sean Hassler. Dr. Hassler started Naturopaths Without Borders, which has chapters in all of the different colleges. He is providing free naturopathic health care for people that are indigent in other countries. The locations he's used, currently he's in Rocky Point, Mexico, where students at Southwest get an opportunity at least twice a quarter to go down. He has a location in Haiti, and they just opened up in Thailand. So here you are, you can do international naturopathic medicine, and he started it about 10 years ago. Here's another example, Dr. April Krause. She went and got her Master's of Public Health, as well as her doctorate degree in naturopathic medicine, and she's in charge of reversing diabetes for the Pascua Yaqui Native American tribe here in outside of Tucson, Arizona. So here's another example of how you can use your degree. And another example is Kelly Hasberger. She's CEO of Natural Health. Again, I'm having a hard time reading. Natural Health, Grand Rapids Natural Health. And sorry about that. Grand Rapids Natural Health. She also is she just stepped down as president of the Michigan Naturopathic Doctors Association, and she also has her own talk radio show. So here's an example where she is, not only is she practicing, but she's also selling products. She's also politically involved, and she has a media presence. Are you beginning to understand the dynamism of this profession? You can do multiple things with your degree. Getting your doctorate of naturopathic medicine opens up incredibly numbers of doors for you, where literally you're not locked into seeing patients every day. You can do almost anything you want to and still make a good living.
Thanks so much, Joanna. Keith, do you want to go to the next slide? So I know that we've already had a bunch of questions coming in today, and but before we do, I just wanted to touch on a few of the things that were brought up and really uh, emphasize the importance of a number of the things that Joanna and Keith said today. And you know, when I'm thinking about career readiness, we talk to a lot of students at the AANMC on career readiness and how to prepare to be a successful ND. And I think that, you know, at the end of the day, your passion is so important, and your drive to be an ND is so important, but so is being prepared. And I think that's really what Joanna and Keith today have talked about, is how do you map out your success? Last month we had a doc on who talked about pain management and her approach to alternative pain treatments for patients. But the biggest thing that I noticed about Dr. Moore last month was she knew what she wanted to do from day one. She was already mapping out her plan to take over the world as she was a student. She was, you know, figuring out her business plan, talking, you know, figuring out her website, getting all of her networking on board, what type of practice she wanted by shadowing NDs, taking a look at NDs. So I know Joanna talked about that, and it's so important. I can't emphasize it enough to really think of the naturopathic degree as an investment in your future. And what is that investment going toward? Like, you wouldn't just make an investment in something without knowing how you were going to use it. And so I think, you know, the more that students and prospective students and even graduates can think about and network with people, and what does that perfect practice look like for you? You know, we have docs who their perfect practice is 2 days a week because they want to spend time at home with young families or aging parents, or they have time for other things, and that's their perfect practice, and that is totally fine. I wouldn't anticipate making the same type of salary working 2 days a week necessarily as a full-time, but that may be perfect for a person at some point in time of their life. Whereas for other folks, really, you know, working full-time and busting their tail and working 60, 80 hours a week while they're starting a practice is what it takes to get it going and off the ground. And so it really varies, and that's why those salary numbers can be, you know, pretty diverse. We see in the salary numbers that there is also, you know, diversity based on, as we said, the number of years in practice. So it will typically take folks about 3 to 5 years to ramp up to a full-time salary, depending. Now, some folks run out the gate and they are ready to go, and they hit that mark much sooner. But most of the graduates that we've assessed say that it's between 3 to 5 years to really, you know, hit the ground running like that. The other things to keep in mind too, as you are setting yourself up for your future, is knowing what you like, knowing what you don't like, and knowing your own personal strengths. You know, one of my mentors said to me years ago, it's like, know what you're really good at and get other folks to do the stuff that you're not. So, you know, I think that it is very important to really consider your own personal strengths, what you're good at, what you love. And one of the things that I hear from folks, especially with the satisfaction of choosing the naturopathic route, we do have one of the higher satisfaction ratings for medical professionals, but it's because folks think, I'm going to work every day and I'm doing something that I absolutely love, so it doesn't feel like work. And so, you know, when I'm talking to people, yesterday I talked to a woman who is a psychologist, and she's considering career change to naturopathic medicine, and I noticed we have a question about career changers. So Keith and Joanna, we have a gentleman here who threw in a question. I'm losing my marbles. Before we go to questions, I want to just let you guys know about the upcoming AANMC events. So next month event is on stress. Who has stress? Nobody has stress. We all have stress, but it's really on how to manage stress, and that, you know, that school stress that's part of the process, how we approach it from a naturopathic perspective. The following month's webinar is on botanical medicines and herbs, and then we will be hosting our annual virtual fair. Actually, we do it twice a year, in the fall and in the spring. And the virtual fair is a chance for you just to sit in your house and log on to a computer and chat with folks from all of the schools, including admissions folks, current students, alumni, professors, and so on. And then last in November, we have a webinar on diabetes with naturopathic medicine. So those are our upcoming events. I will start to take some questions now. So Joanna and Keith, the first question that came in was for folks as a career changer. And so we do see quite a number of career changers in naturopathic medicine. We see folks from right out of college and then career changers. Can either or both of you speak to any tips for people who are changing careers later in life? And for the person who asked, before we get to the question, AANMC hosted a webinar in January. So if you go to our webinar archives, we have a full webinar on career changers with Dr. Dennis Godley, rather. And Dennis spoke for about an hour on his journey into career changers. So that would be really something valuable to check into. So Keith, I think you were about to speak.
Okay, yes, absolutely. So definitely what I would say is with career change, it's not something that is so uncommon as it used to be. But the main thing that I see a lot is where people might have questions. So why are you interested in making this transition? What I would say is definitely make sure to do your research, a lot of what we just discussed, and know why is it that I'm interested in making a transition to naturopathic medicine. So if you get those questions, you understand it, you feel confident, and just take it step by step, one step at a time.
Joanna, anything to add?
Yes, I do. One of the things I asked when I have prospective students coming in saying they want to become a naturopathic physician, the most important part is assessing their passion and understanding the changes that are going to occur. One of the, and usually they're older, they've had another career, they're used to making, good money or have a certain lifestyle. And it's like, okay, guys, this is really going to change. You have to be passionate enough and believe enough in the medicine to make these kinds of changes in your life. The other issue is you've been away from academia for a while. So it's important for you to know whether or not you can handle the academic rigor that's going to occur, because it's going to be you're going to be going to school from 8 to 5 with 4 to 5 hours of homework every day. And at SCNM, you might even be going to classes on a weekend. So and it kind of goes back to what Keith was saying, how important is it for you to make these changes? Given all the wonderful things that you can have afterwards, and you can, because once you get your doctors of naturopathic medicine, all kinds of opportunities are there for you. But the question is do you have the energy? Do you have the passion? Do you have, the ability to change? Because we have families that are involved. This is another thing where you need to get your family involved. Husband, wife, kids, all have to be on board. Many times you're going to have to move. All of that needs to be taken in consideration in order to make it work. And with that being said, our career changes are some of our best docs because they have that life experience behind them, and they wind up doing extremely well.
And so as a follow-up on that question, somebody was asking about areas in natural medicine and IT. And there are a number of, so it's really funny. One of the things that we hear about from our graduates right now, that they're loving the diversity, they're loving the ability to take this one degree and really make their own pathway. For some folks, that's a little scary because, there are people who just want, I just want a job, I want a cookie cutter, I just show up and get a paycheck. But for folks who really have, this driving passion of theirs and the desire to make their own way and make their own future, that canvas is open and it's ready for you. And so the person who was asking about melding IT, so we have naturopathic doctors who have created online platforms, online business platforms, business management platforms, tech solutions in medicine. There are folks who are creating apps and they're doing all sorts of stuff. There are people in the nutraceutical community who are melding nutritional supplements and technology. doing some really neat things there. The founder of Bastyr University, Dr. Joe Pizzorno, he created an online basically way of diagnosing and treating, and so there are so many different opportunities for folks. And then also from like the web pages and web mastery type things, you've got NDs who create master websites that do lots and lots of things for them, where they're scheduling and their patient care, and a lot of those things are managed using technology and harnessing technology to save on time. So I absolutely, the thing about career changers, and when I was in school, I was the youngest one in my class, but we had folks who were accountants and construction workers and dancers and massage therapists and nurses and flight attendants and engineers. We had so many people with very diverse backgrounds that really enriched the experience in naturopathic medical school. And so I don't ever discourage folks who are looking at a second career. You're never too old. You're never too old to learn. And so, I just always want to inspire folks to don't give up on your dreams if there really is something that is driving in you to learn. But that said, there are so many different bridges and different areas where you can mesh those skills. I don't know if Joanna and Keith, if either of you have seen folks who have meshed the like web versus medicine divide.
Well, this is Joanna Hagan. One of the things that came to mind when you were speaking, Dr. Yanez, was the fact that I don't know if people realize that $15 billion are being spent in this field. $15 billion. And right now we're pumping out maybe 500 to 1,000 new NDs. That means that there is a tremendous amount of opportunity. When it comes to IT, I could see that person running the IT department for a nutraceutical department, because they know all the aspects of it. They could be writing like a technical writer for websites. Matter of fact, I spoke with a prospective student who developed websites, and his whole role now is going to be developing websites for our brand new grads, and he's going to make money at it while he's a student. And in the meantime, he'll be able to open up his own business. So, it just takes your imagination to figure out how to make the connections. That's basically it.
Yep. Thank you. So there's a question here on career readiness, and if you have any suggestions for the time and diverse experiences that students spend in other types of settings, hospitals, clinics, other organizations, before going into their own clinics. So, what do you recommend for students to check out when they are looking into the type of clinic that they would want to open up for themselves? And Keith,
okay,
maybe you can start. Oh, I'm sorry.
Keith, I was going to start. One of the things I tell our students to do is to start getting shadowing opportunities as soon as you possibly can. So what you want to do, once you're a naturopathic student, you actually have an in to getting into an ND's office to do shadowing. So that's important, number one. Number two, you need to know what you're looking for. That's part of it. We actually have a course in SCNM that teaches you how to observe. So you get a person off the street and just walking into a doctor's office, what are you looking for? What's important? What are some of the things you should be looking for? Once you learn how to do that, now you can start assessing all the different doctors that you've gone to as to what their strengths are, how they practice, what kind of approach do they use, how does their front desk work, what are some of their business practices, some of their policies, learning all that stuff so you have a complete understanding of all aspects of this medicine, because you're going to be learning just the medicine, but the other part up to you is to learn the business of this medicine, and that's the key. Keith?
Yep, absolutely. I would say that was a 100% perfect answer. And just to kind of sum that up, I would say that it's never too early to start. You want to make sure to be proactive, be your own advocate, know what kind of opportunities are out there. If you're wondering about, how is this office run, or what are some things that make that office successful as opposed to another office, go find out. Do informational interviews. There's a lot of different ways where you could go out, learn more information, educate yourself, gain experience without it being too forward. You want to make sure that you're starting your network. Every time that you go and you meet with someone to learn how they do something, you're building your network, you're making connections, and it's all about letting people know what you're looking for, what your future goals are. But again, it's never too early to start.
Yeah, and along those lines, Keith, if I could just add, it's never too early to start developing your own professional presence. Oftentimes I'll see folks and they'll email me very casually, and like a one-line little email, and it isn't that we think anything less of that, but I think the more that you really start to treat this as a profession, and when you are contacting people, that you contact them professionally, that you present yourself as a professional, the more they'll start to see you as one. And so I think that get your head in the game from day one, like they're saying. Start to think about yourself as a doctor already, and you're a future doctor, and get your mindset there. Communicate with people. If somebody gives you a chance, say thank you, write a handwritten thank you note, do all the things that, our moms told us to do when we were kids. But, write those thank you notes or thank you emails, call up people when, and in a timely manner if they give you a phone number, be responsive, be professional in all of your endeavors, and so that when somebody is thinking, you never know who could potentially be a future employer. You don't know who could potentially be a network to a future employer. So you really do want to start early with a good professional foot. And I can't emphasize that enough. I think that is also something that is important and doesn't always get through to people. They think, oh, well, I'm just a student right now, or I'm just kind of looking at this. We are a small profession, and so, having a really strong network from the get can be very helpful. Okay, so another question came in. Can you speak about dual degrees? What are the benefits? What are, when would they be beneficial? What are, how do you counsel students on dual degree tracks and programs?
This is Joanna Hagan. I'll speak to that. Dual degrees are one of the aspects of dual degrees is it would be a degree in licensed acupuncture as well as ND. And what I find is most people with dual degrees are the ones that want to practice in unlicensed state, because acupuncture is licensed, but ND may not be. So you can practice naturopathic medicine, or a good chunk of it, under the licensed acupuncture degree. So that's one of the strategies that people use for having dual degrees. But you can have another degree in, I'm trying to think, what other degree would you have? Oh, I just went blank.
Oh, there are so many, Joanna. So there are dual degree programs at all of the naturopathic medical colleges. There are so many master's programs now that are being offered, whether it's nutrition, public health, midwifery program certifications. There are
right. Yeah.
chiropractic programs.
I mean, it just opens up more doors for you. Basically, having a dual degree opens up more doors, even more. Not that there's not enough doors opening up for naturopathic, but it's even more. So a lot of it has to do with what you want to do, where you want to do it, and that determines whether or not a dual degree is appropriate for you.
Absolutely, and just to add with that, usually we here at UB, so we have a lot of different programs, but whenever we have students who come in are interested in dual program, we'll always try to look at what is their ultimate goal. Does this degree make sense, especially to do an additional degree or dual degree? So just really making sure that you're not just jumping into something, but it fits along with what my interests are and what I hope to do in the future. But I definitely think that it would be a great additional package to be able to offer, but I wouldn't say that it's 100% necessary if that's not what your passions are.
Thank you so much. Yeah, again, if I could go back again to just talking about the degree as an investment in your future, any degrees that you're getting should have some sort of a goal that you're working toward. And so if your goal is, you really love manipulation and or you really love delivering babies and you want to have more flexibility to do that and have reimbursement for that, then getting a dual degree in midwifery or chiropractic might be a route for you. But again, dual degrees, I always think of them as, what's the end in mind? I went back, so I got my ND first, and then I went and I practiced for a number of years. I saw patients, I taught, and then I started working on policy and legislative affairs, and found that I really loved it. But in order to take myself to the next career level, I recognized that I needed a master's in public health or some sort of additional degree. And so I went back with a specific focus and a very targeted goal, and went and got, I found the best program for myself. I went and got that degree, and then, pretty much immediately after graduating, found my next step and my next career path. So I think, again, if you're looking at any degrees, it's what are you trying to get out of the investment? And so I'm sorry if I sound like a broken record there. Okay, we've got a few more questions here. So how often do you see and how easy is it to switch professions with naturopathic medicine? So working with, starting with, some type of specialty and then maybe changing your mind in a few years or opening up a different type of a practice. Can you speak to the flexibility in changing focus for folks?
Can I take that one?
Absolutely, please.
Yeah. You know what the biggest challenge is in changing specialties is how do you sell all the equipment you just bought? That's it. It's incredibly easy. It's simply a matter of changing your focus, changing your message to the community. You just stop seeing patients of a certain type and only see patients of another type. I mean, that's it. It may take you a while to get that message across. Remember, you're rebranding yourself in the healthcare community, but a simple matter of referring patients out to another naturopathic physician that's doing the things that you don't want to do versus the ones you do. But I've seen, if anything, people are changing just, how do I get rid of my OBGYN exam table or whatever, any kind of equipment that they may have bought that was specific to another specialty. And that's it. The rest is just changing your message and being very, very, keeping your strict boundaries, and that's it. It takes time, and it's just a rebranding issue.
Absolutely agreed. And with anything in life, such as when we were talking about career changers, nothing's kind of an end-all be-all. So if you're interested in exploring something else, it's absolutely possible. It's just what you put into it.
Thank you. So can either of you think, so let's say you have a student who is interested in oncology or interested in a specific track. How would you recommend opening the door and looking into networking so that maybe they could get a very specific residency in like oncology or pediatrics?
I'll take that one. This is Joanna Hagan. Okay, the first thing I would tell the student is to, I would probably give her or him different leads of different doctors that they could start interviewing or shadowing. And hopefully in the geographic area, and that's the other important thing, the geographic area in which they want to practice. So you want to create relationships with doctors in the location that you think you want to be in. So the most important part of your decision is location, 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 just like all the other things in business, because the where determines what you can do. So that's another issue. So you're visiting oncology doctors that are doing oncology in the geographic area that you have. You do informational interviews. You do shadowing or observing, and you continue that, and maybe even later on in your ND school career, you set up rotations with them, and you figure out which ones you like the best and which ones resonate the best with you, and before you know it, you're probably going to be invited into one of their practices. If you're interested in an oncology residency, then that's a different path, and that we should probably talk about getting residencies. We do have residencies. We have about 77 of them for about 500 grads nationwide, so they're very competitive. But that includes a lot of the career readiness things that Keith talked about. They look at critical thinking, they look at leadership, they look at research, they look at teaching abilities, they look at all your outside activities, and again, it's not the minimum, but it's what are you doing outside of the school and what kinds of activities, and then your clinical evaluation, and all of those things come into play in determining whether or not you get a residency. You also have to write 3 essays and provide your transcripts, and all of that's reviewed by a board, and they take it from there. So if you're looking for an oncology residency, one of the things I would tell you is just get basic. One of the things I hear is they don't want a lot of oncology. They want you to just have basic naturopathic experience with a little bit of oncology. So you don't focus everything on it. I'm trying to think, was the other one you were talking about was oncology, and then what was the other field? I can't remember. At any rate, I hope that helped.
Thanks, Joanna. Go ahead, Keith.
No, absolutely. Again, I think that was a great answer, but definitely what I would say is that we want to start growing your network and also gaining some exposure. So a great way, what we usually tell our students, is to start off with informational interviewing. Because even though you may not be ready to do some actual clinical experience at that exact time, you're interviewing the professional, you're learning more about their field, but they're also seeing your interest and they're getting to know you a little bit more. So if there were an opportunity that may come up, you want them to be thinking about you. That's the first name that comes to mind. But the only way to do that is to expand your network. So I would again say informational interviews are great, job shadowing is great, but definitely try to get network and gain some exposure as early as possible.
Thank you so much. Would you be able to speak on, so there's a question here about the cost of ND school, and like I said, it is an investment in not only money but also time. So can you speak to the Public Service Loan Forgiveness Program and resources or tools that can help people set up a way to make the loans more affordable when they get out?
Sure. I could even just talk briefly about the Public Service Loan Forgiveness, just because thankfully I've been able to be accepted into that program. One thing what I would do is to definitely contact wherever your loans are coming from, the agency. So if it's Fed loans, just contact them and let them know that you'd be interested in this program. It's usually as simple as actually pulling off the application directly online from your server provider. You fill out the application, you just have to verify wherever your employment is, you send in the application, and usually within a month they'll have some information if you've been approved or not. But there are definitely a lot of options out there for student loan forgiveness or repaying different options, and it's always be sure to look into seeing what kind of options do your provider have available, because there are out there, I know many people who are just paying their loans and complaining about them when there are actually a lot of options that could hopefully knock down some of that debt for you without having to pay it all at once.
I agree. One of the things you need to know about the public loan forgiveness is, number one, you have to work for a 501c-3 nonprofit. So what does that mean? That means it could be a school, it could be a hospital, it could be just a nonprofit indigent clinic, it could be anything that's a 501c-3 entity. You need to work for it for 10 years. You need to pay on your loans consistently. There's no interruption. And at the end of that 10 years of paying on your loans are forgiven, and there's no tax consequence at this point in time. Now, if you don't work for a nonprofit, you have lots of other options. You have the income-based repayment plan, which is what most of our grads take. And what it means is that the federal government cannot charge you more than 10% of your discretionary income for a loan if for a loan payment. You have 20 years of paying for it on time, and at the end of 20 years, the remainder of the loans are forgiven, but there is a tax consequence. And that's basically what most of our people do. And you need to understand the loan payments are like $158, or $200 a month. Remember, it's pretty, it's less than a car payment. So it's pretty doable in the beginning. Just remember, the more money you make, the more money the federal government takes.
Well, and again, I don't want to get into specific numbers for folks right now because I do know that there are many people who are paying quite a bit more than that, Joanna, so I would hate to mislead people. But I think that, at the end of the day, there was another question about business loans. And if you have any questions related to financial aid or related to businesses, business loans and the payment function, all of the ND schools have financial aid offices. So I would highly recommend getting in touch with the financial aid offices and asking any specific questions that you have for your case, just so that we're getting the right information for you. I would hate for somebody to think, oh, I only have to pay $200 a month, and that may very well not be the case. So just want to make sure that folks get connected with financial aid offices and understand their circumstances and their situation and what would be the case for them. Okay, so we have just a few more minutes in our webinar. There was a question here about state licensure and practicing in pre-licensed states as well as scope. And I know Joanna had spoken a little bit about location. Location is very important in choosing where you want to go. So I think of this from the perspective of, you're opening, especially if you're opening up a clinic, you're opening up a small practice and a small business. And so if you're going to do that, imagine all the marketing that has to go in. You have to choose a location, choose an office, do your marketing, print up all your materials, do your networking to support that location. So when you choose a location, whether it is in a pre-licensed state or in a licensed jurisdiction or regulated jurisdiction, I really implore folks to think about it seriously, because when you do make that investment in creating a location, creating an office, it's an investment. And I see folks who, they'll go someplace and they'll do all of that, and then 5 years later they pick up and they move and they have to reinvest in a new area and start over networking, and in some cases it's almost like they're starting from scratch, depending on how far away they moved. So I highly implore folks to think about the location where you're going, the scope of practice. I know that there was a question regarding state licensure and what the scope of practice is in each of the states. So the AANP is working on a document that would detail that out right now. We do maintain a list of the licensed and regulated jurisdictions in North America, because we also represent the 2 Canadian colleges. So I would visit that and see. The other thing that I would say is, if you're considering a jurisdiction or a state that is unregulated at this time, reach out to the state association. Many of the state associations have annual conferences. So go to a conference, like Joanna said earlier, go to one of those conferences, network with folks, understand what the climate is in that state, where they are in the licensing process, what you can do to help, so that you really go in with open eyes. Years ago, when after I graduated, I had been working in Arizona, and then I went back to New York, and we were still pretty green back then. We didn't quite understand the jurisdiction, and so I worked with the president. I was on the board, and we put together documents for people coming into the state. So, like, hey, you're a new student, you're coming into the state. here is a packet of information to help you understand how to do this safely, what being in a pre-licensed state means, and what that means for you and your liability, and if you do have a second degree, and all of those types of things, so that you're following the law. Because I think the biggest thing that we recognize in pre-licensed states, new grads will come out and say, oh, I'm trained to do all of this stuff. And if they go to a pre-licensed state without another designation, I just want to make sure that folks understand the law, and they're following the law, and they're practicing within the law, and they recognize what the law is within that state for what they can do. So that's the biggest thing that I would say, Jacinda, for your question there. So let's see, another question about licensure here. Is it possible to obtain a working license in more than one state? Yes, there are actually a number of doctors who work intrastate. There are folks who, practice in Vermont and Connecticut. In fact, I know one doc who practices in California and Connecticut. I don't know how he does it. It's crazy. But yeah, there are plenty of folks who have multiple state licenses, so that is a possibility. So let's see. There's one last question here. I'll probably start on this, and Joanna and Keith, if you have anything to add, feel free to jump in. So there's a question about insurance and naturopathic medicine, and so this is a sticky topic. So there are lots of different types of insurances, obviously. So there's private insurance. And in the private insurance model, there are a number of states where naturopathic physicians qualify for insurance, and some where they're qualified for insurance as primary care providers. And then there are other states where insurance coverage is either piecemeal, so it may offer some coverage, or a patient may need to submit something in on their own for a doctor to be covered under their insurance plan, and other places where there is no coverage at all. And so it does vary, so I always tell folks to check in with the state and the insurance plans that they have on the coverage for naturopathic care, because state insurance does vary from state to state. In regards to public programs like Medicaid and Medicare, Medicaid is state mandated, and so that will vary also by state. Some states do cover Medicaid for naturopathic physicians, and some do not. Medicare is a federal program in the United States, and so that at this time does not cover naturopathic care. And then in Canada, naturopathic providers are not covered underneath the state mandated system. So anyway, that's kind of the general gist of the insurance question here. So Joanna and Keith, I know we're coming up on time. Are there any last quick pearls of wisdom that you want to let folks know about before we sign off?
Yes. Do your homework on naturopathic medicine before you sign the dotted line. Know what you want, know where you're going, have some direction, and that will provide a lot of comfort and direction for you during your naturopathic schooling career.
I forgot I was on mute, sorry. But exactly as Joanna said, is that you make sure to do your research, but I would definitely want to add to that is to be proactive and, again, be your own advocate, because if you want to make the best of this profession and you want to make sure that you're successful and make a difference in many people's lives, you have to go out there, take advantage of different opportunities that are available to you, look at what kind of shadowing opportunities are available. But definitely I would say is start laying your path. Be knowledgeable about your own branding, again, with those emails that you send out, but definitely be your own advocate and take the steps that you need to.
And social media.
Absolutely.
I think that doesn't get said enough, but employers check social media, and they check your profiles. And so, what? Again, when we're talking about professionalism, professionalism is all encompassing now, and things that, when it's on the internet, it stays on the internet forever. I had a mentor of mine say, never put in an email what you don't want to see on the front page of the New York Times. So, I just always think about this, your social media presence, what type of image are people seeing, what's your public face, and really working, I think one of you just mentioned your brand, thinking about your own professional brand and what is it that you are putting forward as, your your way of shining and making the world a better place. And so with that, I think, unless, do either of you have anything else to add?
No.
Consider using LinkedIn.
Yes. Yeah, social media in general. So thank you all for coming. I'm going to stay online and answer a few more of the last questions that have come through. And we did have a little glitch with the recording. I think we got some of it started recordings halfway through. So we will be posting that a little bit later on today. And again, stay tuned for our future events. We have them typically every month. And thank you so much for coming and spending an hour with AANMC. Signing off now. Have a great day, folks. Thank you, Joanna and Keith.
Thank you.
Thank you. You still on?